What is up, guys? I'm Westin Antoszewski. I'm a nursing student at UT. Here's my badge. This is my boy David. He's my patient today.
I'm David Knight, and I give Westin Antoszewski permission to evaluate you.
All right, I'm gonna do a 360 room scan now. All right, so today, first things first, I'm gonna walk into the room. I'm gonna wash my hands, and I'm gonna introduce myself. My name is Westin, and I'm gonna do 2 patient identifiers. So what is your first and last name?
David Knight.
And then your date of birth?
10/30/98.
All right, so next I'm gonna explain to the patient what we are doing today. We're gonna be assessing your arms, legs, and your heart sounds. And then we're gonna provide privacy if needed, and I'm gonna apply gloves if needed as well. So next what I'm gonna do, so what is your past medical history? Anything I should be concerned of? Any past illnesses or current illnesses, current issues?
None.
None? Okay. Have you ever had like do you have CHF?
No.
Any deep vein thrombosis?
No.
Or history of strokes, anything like that?
No.
Okay. So now what we're gonna do, I'm gonna ask you to take your shirt off. All right, so I am going to be assessing David's intercostal area. So as I'm going to name the intercostal space and the different regions, and I'm going to be auscultating at the same time, and then I will conclude my findings at the end. So first, I'm going to locate the second intercostal space. So. Here's the second intercostal space, right sternal border, and this is the aortic region, and I'm going to go ahead and auscultate that. All right, now what I'm going to do, I'm going to go over here, and I'm also going to find the second intercostal space. Right, this is second intercostal space. This is left sternal border. This is the pulmonary region. I'm gonna auscultate this. All right, now I'm going to find the third intercostal space. All right, we located that. That is also left sternal border, and this is Erb's point. This is where you hear things like murmurs and murmurs. I'm gonna go ahead and auscultate that. All right, now I'm gonna go to the fourth intercostal space. That's right here, and this right here. This is the tricuspid region, and I'm going to auscultate that now, and that's also left sternal border. All right, I'm going to find the fifth intercostal space. Okay. That's right here, right below nipple line, and that's the fifth intercostal space, and that is the mitral region, and this location is midline clavicular region, or so like mid clavicular. So what I'm going to do is I'm going to auscultate the mitral area. All right, so to conclude my findings, heart rhythm was regular. I heard S1 and S2 noises, and there was no absence of any heart murmurs, no heart murmurs. So now what I'm gonna do is I'm gonna pick a spot, and I'm going to pick the mitral area, and I'm gonna listen for 30 seconds, and if I find any abnormal or hear any abnormal sounds, I'm going to listen for the full 60 seconds. So I'm gonna start right now, and here we go. All right, so I counted 24, and 24 times 2 is 48. So the normal range is 60 to 100. David's heart rate is 48, so he must be an avid runner. Maybe goes to the gym a lot. So it is below normal ranges. So now what I'm gonna do is I'm going to assess David's arms. So let me see your arm, David. I'm gonna look for any inflammation, redness, or any type of lesions. I don't see anything here, except, yeah, there is a lesion right here in the form of a scar. Secondary lesion. I'm gonna go to his other arm. Also gonna look for any inflammation, redness, lesions. So there are no lesions, redness, or inflammation in both arms except for that one scar, which is a secondary lesion. And skin looks tannish, beige, with a pink undertone. And now what I'm gonna do is I'm gonna test David's grip strength. So go ahead, David, and grip my fingers. Right. So David has a firm grasp. Strength is equal bilaterally. So now, David, now that we assess your arms, I'm gonna have you lay down here, and I'm going to assess your legs. Right. So here, first, I'm going to look at hair distribution of David's legs. Right. So the hair distribution, it's evenly distributed. So the hair is longer down towards the shins and shorter towards the thigh area. So and it's not perfectly even, so it's a bit uneven. So now what I'm going to do is I'm going to look for condition and symmetry. Right, so symmetry, they're symmetrically wise, they are equal bilaterally, symmetrical, and skin is intact. Now I'm going to look for color variation. So as I'm seeing, as I'm inspecting David's legs, he's tan down towards his shin area and more pale towards his thighs. So nothing concerning. It's just David must wear like longer shorts, so he's just out in the sun in summertime and he's more tan down in this area. Then I'm gonna look for any vascular or venous distribution. So I'm not finding any spidering or varicose veins. All right, so the findings there are normal, and now what I'm going to do is I am going to inspect for any type of lesion. So there's 3 types of lesions. There's primary, secondary, and there is vascular lesions. So what I'm going to do now is I'm going to look for any primary. Primary are anything like freckles, tattoos, or not tattoos, freckles, birthmarks, and not finding anything. Actually, there's a freckle right here, right below David's knee. Size is pinpoint. Distribution, there's only a singular freckle, so there's nothing else around it, and the shape is circular. And then secondary, I didn't notice any scarring or tattoos, which are secondary. Then third, vascular. So David does not have any ecchymosis, which would be vascular lesions. So now what I'm going to do is I'm going to palpate David for any edema or anything like that. So I'm going to check for pitting and any type of swelling, which is edema. So I'm going to start up towards the thigh. I'm going to work my way all the way down to David's toes. All right, so David's left leg, I did not notice any pitting or edema, so now I'm going to go to his right leg. All right, David's right leg, I did not notice any pitting, no edema, no swelling. So now I'm going to check the temperature and moisture of David's legs. So I'm use dorsal side of my hand, and I'm going to gently go down from his thigh to tip of his toes. All right, so in terms of temperature, the temperature, as I went down, it got cooler towards his toes, and the finding there was good, and or it was a normal finding. And then in terms of like moisture, there was no moisture, it was dry. So now I'm gonna do the same thing to his right leg. All right, same on this side, his right leg. So as I went down, I didn't notice any moisture, just dry, and not like overly dry, just like just not moisture. And then as I went down, the temperature got cooler towards his toes, so that is a good sign. So now what I'm going to do is I am going to check David's dorsiflexion and plantar flexion. So David, I'm gonna have you, what I'm gonna do is I'm going to put my hands up on your feet, and then what you're gonna do is you're gonna like doing a calf raise. You're gonna push toward, hold on a second. All right, now push hard. All right, so David's plantar flexion is in terms of strength, strong, equal bilaterally. So now I'm gonna have David that was the plantar flexion is strong and equal bilaterally. Now the dorsiflexion I'm going to check, and as I pull forward or pull towards me, David is going to pull his toes upward. So David, pull your toes towards the ceiling. All right, so strength of David's dorsiflexion is in terms of strength, it is equal bilaterally. So now now that I did that, what I'm going to do now is I'm going to check the dorsalis pedis pulse, and I'm going to determine the strength of that. So, right. Right, so on his left foot, I would get that a plus or a 2+, and it is elastic. And I'm going to do the same thing on here. All right, that is a 2+ as well, and also elastic. So now what I'm going to do is I'm going to check David's his posterior tibialis, and I am going to assess the strength of that as well. And all right, I'm going to grade that a 2+ as well, and it's not weak. I can definitely feel it, but not like to bounding, and it is elastic. And I'm gonna come over here, check it on the same side. So the posterior tibialis on his right foot is, I get it a 2+, and it is elastic. So now what I'm going to move on to next is I'm going to check any, David has any ulcerations or any sensory alterations of sorts. David, have you experienced any tingling or numbness in your feet, legs, or anything like that?
No.
Right, that's a great sign. So I'm gonna check for any ulcerations. Right. So far, as I am inspecting David's leg, I am not finding any ulcerations. Right. So no ulcerations. He does not have any numbness or tingling. So now what I'm going to move on to next is that concludes the part of his leg assessment. And now what I'm going to do is I'm going to comfort David. So I'm going to cover David up with a blanket, and so yeah. So are you comfortable, David?
Yes.
Right, that is great. So what I'm going to do now is I'm going to lower the bed to the lowest position, raise the side rails ×2, and put the call light by his bed if needed, and then I'm going to provide privacy. And then to conclude everything, I'm just going to document my findings, and yeah, that is the end of the assessment, and thanks for watching.